Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
Hi there. Welcome to the 36th episode of A Couple Takes on MS. Hi, this is Dan Digman.
And hi, it's me, Jennifer Digman. Sorry, I was just laughing and I lost my breath. Don't you hate that about multiple sclerosis? When it just totally sneaks up and your voice gets weak. Anywho, as Dan said, this is our 36th episode of A Couple Takes on MS. And in case you've never listened to our program, Dan and I each have multiple sclerosis, thus A Couple Takes on MS. But we are each living with a different form of the disease. So we have different perspectives of life with multiple sclerosis.
And what form do you have, dear?
Mine is secondary progressive. And what about you, sweetheart?
Why, Jennifer, I have relapsing remitting MS.
And that is a couple taking on MS.
So today, what we're talking about, thank you for joining us, we're talking about difficult topics. The topic is no such thing as TMI, as in too much information. I mean, there are things that those of us living with multiple sclerosis, very personal issues that you're just not always comfortable in talking about.
And you're not comfortable talking about it with your spouse, or your partner, or your caregiver, or your doctor. And that's why Dan and I wanted to bring this to light. You know, the realities that those of us living with multiple sclerosis can't really hide and we need to talk about, but sometimes we just really don't feel comfortable.
And see, what's interesting about this as we talk about those topics of which we're not comfortable in talking about, we're not addressing those and saying them out loud. It's just like how we feel uncomfortable about talking about bladder issues, bowel issues, sexual dysfunction. I mean, things that make us all blush.
That certainly make us blush, and I suppose that, you know, I've been living with the disease for 20 years. And I know 20 years ago, my biggest fear was someday having to use a catheter. And for those of you that know what life is like using a catheter, you understand. And for those of you that don't, you may have the same fear. And I am happy to say, I don't know if that's the right way to phrase it, but I'm not using a catheter, but I have always been really proactive in seeking the treatment of a urologist, and I think that's helped me. And so that's one issue that I know can be difficult to talk about, and that I guess goes into maybe one of the first things that we have to say about the difficult conversations you need to have or topics.
Well, and I think it's really what we're trying to do here today is just to give you really insights, like 5 different things to think about to make you more comfortable or to help you be more comfortable in having these kinds of topics. And I realize that when we're talking bladder, bowel, sexual dysfunction, those are just very on the surface 3 different, major issues that those of us with multiple sclerosis deal with in talking about this. But it's just like to make you more comfortable in addressing these things with your family, with your doctor. And really, I think the first thing to think about is the reality is when you're dealing with a difficult issue, a personal issue, it's not your fault. I mean, and know that it is not your fault that you're dealing with this.
Yeah, and it's not, I mean, I feel that it's important, and I'm circling back to why I said that I've had the disease for 20 years. Dan, you've been living with MS for how long?
18.
So I feel
18
like,
years.
yeah, 18 years. I feel like we're pretty knowledgeable and able to say this, and it is a really important thing to think about. None of us have asked for multiple sclerosis, and none of us asked for the issues that go along with it. You know, they can be uncomfortable, sexual dysfunction or bladder and bowel issues, and it's not our fault. I doubt there's a single one of us out there that was like, oh, goody, I have MS. I get to live with a chronic disease of the central nervous system for the rest of my existence. So I think that's a really big thing. It's not your fault. We didn't ask for this. And we have to remember that and just be how we respond with it.
Well, it's like to not be ashamed of it. It's like these are just realities that we're dealing with that we don't that we have no control over, and that so it's just like it's not our fault, and so we can go forward. It's not like when you're a kid and something happened and you're embarrassed by it. It's just like you don't need to be embarrassed by any things that you're dealing with multiple sclerosis.
And I guess that ties into the second thing. You know, if it's not our fault and we're dealing with the disease, which I hope all of us out there in the community, whether you're a person living with MS or the caregiver of someone, you're dealing with it. You're taking your disease modifying medication and your symptom management. And you're watching your diet and you're participating in exercise and you're trying to stay healthy. So if we can all agree that it's not our fault, we need to agree that to wish something away is not an effective treatment option. You know, when you start leaking bladder leaks sporadically, or you start having pain when you go to the bathroom and you're like, oh, I'll deal with that later, that's not an effective treatment option. So you need to be open with your spouse, caregiver, or doctor. And most probably, realistically, you need to be open with yourself and your doctor. You have to address it.
Well, I think when you're dealing with multiple sclerosis, think back to when you were first diagnosed or when you had your first symptoms. I know that a lot of times when you're talking to people and about their multiple sclerosis and you say, when were you diagnosed? And a lot of people will say like, oh, I was diagnosed in 2000, but I started having symptoms like in 1997 and everything. And so it's just like, if you don't address these things or make it known to your doctor, like as soon as they happen, there's no way for them to trace it to log it in to see where it's going. I think anytime I have a new symptom, I'm not going to be the town crier or hypochondriac, is that the word I can say, that anytime I have something, but when there's a noticeable issue, just to let my doctor know about it so that it's there, it's on record, so like in another year I'm having this issue, they can't act as though this just happened. And so I mean, especially when you're having these personal issues that are really difficult to talk about, the sooner you can address those, the quicker they can treat it, or at least have the record so that you know in the future.
Yeah, I mean, pain when you're urinating, you can call your doctor and they can do a quick urine specimen and say, yes, you have a UTI, and prescribe some antibiotics, and your relief could be quick, or you don't want to let something like that fester and get worse. I'm sure plenty of you out there are shaking and nodding your head that can get a lot worse to something that simple. So really you need to be proactive and not wish away your problems or your concerns, deal with them, confront them head on.
Well, I think that way too, it does away with the anxiety that you have in trying to hide it or shield it. I think just when I was first diagnosed with multiple sclerosis, I know that I went to my boss the day after I was diagnosed and told her that I had this, because I didn't want to have, adding to my stress level of having multiple sclerosis, the fear of hiding it or anything, or being in shame. And so the quicker you can take care of it, then you feel empowered that that's where, that's something
That's
that you're doing to take care of yourself.
absolutely, and I think that empoweredness and taking control is really, it ties in well with the idea that you are not the only one that's living with this disease. You're not the only one living with the disease. Your partner, your spouse, your caregiver, your doctor, but also in the grander sense, look how many of us are listening to this radio show right now. There are what is it, 2.8 million people living with multiple sclerosis. So when you spoke to your boss about having multiple sclerosis, that took away some of the stigma of the disease, and you realized that you weren't the only one going through it. But also, you're not the only one who is having bladder leaks or some sexual dysfunction. You're not the only one who is living with those experiences.
Well, you think about it. Look at what's on the TV. Look at what's in your magazine, the advertisements for the
Medication.
the medications for sexual dysfunction, to be able to go and get your Depends, things like that, for people with bladder leaks. That it's something that so many people are dealing with. The fact, if you really think that all those commercials, all those ads, all those products that are out there are developed just for you, you're sadly mistaken. That it's just like it's out there, and I think that's the thing. It's just like people are afraid to talk about it, so it seems like you're the only one. But that's why, obviously, you're not going to go walk down the street with this, because there are some things that are very personal. But at the same time, to be able to be open to talking to your family, your doctors, people that are there that you pick to be on your team, that you need to be comfortable in talking to them.
And that does, as we said, take away the stigma. And, having to use bladder protection, watch a soap opera or watch a talk show in the middle of the afternoon. You're inundated with commercials for female or male products that can help: protective underwear, liners in your underwear, help with those small leaks. And I guarantee, I'm in my 40s, that I don't have a girlfriend who doesn't sneeze or laugh and wince a little, because the bladder muscle it's a muscle and it gets a little weaker, and especially women who have had children. And that's why the community that we belong to, as what's the word I'm looking for? We didn't want to become part of this community, but we're in the community of the MS, people living with the disease. Reach out to others, and you'll realize you're not the only one that can talk about small leaks or that can talk about sexual dysfunction. Heck, watch an NFL football game on Sunday. You'll see lots of commercials for Viagra or for Cialis. It's a common thing, and to be open takes away that stigma and takes away the shame. Because again, it's not your fault, this disease, and what it's doing to you, you're taking back control.
And I think that's what it is. It's like it empowers you, or you feel more at ease in talking about it and saying that this is what I'm doing. Because obviously, everything that we're talking about, everything that's quote unquote too personal, those are things that are affecting your health, that are affecting your livelihood, that are affecting you. And by talking about it, getting it out there, you're taking charge and getting treatment and finding ways to make this better for you, because at the end of the day, it truly is about the quality of life.
Yeah.
And you're just regaining, because obviously everybody needs to be out there, needs to be comfortable in going out in public and not be fearful of leaky bladder, or to be sexually active. That's part of the quality of life.
Absolutely.
And so now we'll get all, I don't want to get crass about things, but in talking to your doctor, like with sexual dysfunction, I mean, how proud must you be? I mean, just that I am sexually active, that this
I
is
am.
what I'm doing, and that,
Absolutely.
and it's not only for you, but it's for your spouse, for your partner, for your family.
And it is a big piece, a big part of quality of life. And it is important, and that's why you need to address it and talk about it, because there are options and there are things that can be done. We're saying talking about it gives you control. Well, recently, it was maybe 2 weeks ago, I saw a new urologist. I had a doctor here that I saw for the past 12 years, but her practice went in a different direction, so I had to find a new urologist. And the first moment I met my new doctor, she asked me about my medication, and I said, "Oh, doctor, I've been taking this drug for the past 10, 11 years. And she said, "Well, how's it working for you?" And I told her, I said, "Good, my bladder's pretty well under control and I feel pretty confident." And she asked, and forgive my crassness, she said, "How's your bowel movements?" And she may have said it more like, "So do you poop regularly?" And I'm like, "Well, okay, doctor, nice to meet you. Let me tell you more about myself." And she said, "If you're not having regular bowel movements," which I, of course, those of us living with MS, you may understand what I'm going through. I kind of shook my head, and she said, "Then you're not on the right medication." So she prescribed something different. And she said that those two, that bowel bladder function, you can't just look at one piece of that equation. You have to look at both. And so she changed my medication. And had I not brought that up, if I hadn't addressed it, if she hadn't asked and I hadn't taken back the control and said, "Yeah, doctor, I'm not going regularly," I could still be sitting here, but now I'm getting on a new medication, and hopefully that will be even a better treatment option than the one I was using. So I do feel like I took back some control just simply by talking to my doctor.
Well, and that she asks the question, and you could have been embarrassed by that. It's like, if she says, "Do you poop?" and you're just like, and it's like, and it's just like, "I don't want to talk about it." And you're just like, "Oh yeah, sure, no, I'm fine." But it's just like, no, you address it, and you are open, you are honest, and there isn't that stigma of quote unquote TMI or making talking more about it. I mean, obviously, that's where you need to be open with your doctor, and hopefully in that relationship with your doctor, then they're comfortable in bringing it up to you, because there's some things that maybe you're not looking at that they see, and if they're asking the questions, it's opening the door for you to have these conversations.
And I can think what I think of doctors, because I do think that they're awesome. I know my neurologist, my urologist, my primary doctor, Dan's doctors, neurologists, they're all great, but none of them are mind readers. And, we can give a list of medication that we take and we can tell them the symptoms. But if we don't tell them really what's going on, if Dan and I don't want to talk about our bladder or bowel habits or our intimacy and our sexual function, then really we're hurting ourselves. These doctors, they're not mind readers. They want to make the quality of our life the best it can be. And I really think we as patients have an obligation to meet them halfway. And really, if they aren't asking those questions and you don't feel that your issues are being addressed, if God forbid your doctor's like, "I don't really want to talk about that," then you have to do your part and maybe looking for a different doctor. Because you really need to think about your quality of life and the quality of life of your partner, or heck, your caregiver. If you haven't pooped in a month, you're probably not going to be the easiest person to live with, and you have to think about that quality of life that goes on beyond you.
Well, I think that's kind of tying back then to as far as not being the only one and talking to your doctor about it. They see how many patients, and they deal with this stuff all the time, so they have insights. Truly, if you're opening up to them about these quote unquote personal issues, you're not the first person to talk to them about this.
No.
And they've got the insight, they have the experience, they have the knowledge to give you options, much like your doctor, your new urologist did,
Yeah.
to say you should be looking into this. And so there really, on some levels, there is no such thing as too much information, because the more the better, because then you can decipher what it is. And I think, as far as like then the fifth thing to think about in bringing these topics up, it's in talking about it, it helps other people, and it's not only other people who are dealing with your that can empathize with your specific issue, but it's helping your family, your friends, your caregivers, because it's just like you make it easier for them in addressing these issues.
Yeah, absolutely. I know with me in my wheelchair, it can be a little uncomfortable if you're not familiar with disability. When a new person meets me, I want them to know it's okay, I'm comfortable with my wheelchair, and that he or she should be comfortable too. Well, with a doctor or with your self-help group or with your family, if we're open and we're okay to talk about Depends or Attends or any sort of bladder incontinence product, or bowel management, a high fiber diet or using stool softeners. If we're comfortable addressing that, then your caregiver, your partner, should be more comfortable. And I think that talking about it helps others. Again, I'm thinking about our self-help group with the National MS Society. If we can go in and we can talk in a meeting openly and honestly, and what's said within that meeting stays within that meeting, maybe some of the group members will feel comfortable talking about the issues they have. And we can help them, and in turn helping them will help us. That's what we always say: when we share our story, we get the benefit of people sharing their story with us.
Well, and I think it is. I think it's just does away with the stigma. It's just like, because if nobody's talking about it, then of course that keeps it in the uncomfortableness. But it's just like these are these are our realities, and these are the things that we are dealing with. And I think the more we deal with it, the more we address it, especially with your caregivers, with your loved ones, with your doctors. It's like there's an elephant in the room that nobody wants to talk about. It's just like, and so you hit it head on, and it puts
you take that elephant and you say, I tamed it, and I can address it, and we can talk about it.
And open the door and push it out.
Yeah,
it's just
absolutely.
Like, it's done, and then you don't, maybe back to the whole diagnose and not telling telling my boss to relieve a lot of the anxiety and stress. I think in talking about it with others gets rid of that anxiety and stress to make things less uncomfortable or more comfortable.
Yeah.
Because you don't have that thought. And then I don't know, I think it's still difficult to talk about. Again, it took us how long to even say what we were talking about.
Right. And I think about, I don't know if you've seen like movies or television shows where sometimes the go-to joke, it's not appropriate, but they'll make some comment about adult underwear or protective, bladder leakage.
Or little blue pills.
Yeah, a Viagra joke. And it's like, that's not funny. That's quality of life. And so if we're open about it, maybe people will realize that's an easy joke that's really not all that funny. Not everyone goes through this, but a lot of people, again, 2.8 million people living with multiple sclerosis worldwide. And, then you add the caregivers and the friends and the family and the doctors dealing with the disease. We're out there and we have nothing to be ashamed of.
Well, I think that you make a great point as far as the number of people worldwide living with multiple sclerosis. But these types of issues impact so many people beyond multiple sclerosis.
Those of us living with a chronic illness. If you're open and you reach out to people you probably have more in common if you're comfortable to talk about these difficult, I'm air quoting, difficult situations, that it is more and more of us are going through more of the similar situations.
And now I'm just kind of making stuff up, but I'm just, think about the times. Was there a point in time when women going through menopause was like, people don't talk about it, it's embarrassing, it's personal? But now, I have yet to see a woman that I work with, live with, talk to, that is very open anytime they have hot flashes thing, because that's part of life, and
That's
it's just like
nature, and that's exactly it, the reality of life.
and I think maybe because women are more comfortable talking about that, bringing it up, it's not an issue anymore. It's just like I'm a man, but I'm more understanding for you, and not you, but I'm
Yeah.
more understanding to a woman who is complaining about hot flashes things. It's like that's not an embarrassing thing. It's just like that's a phase of life, or even or men with things. It's just like the more we talk about it, the less awkward it is.
Less stigma, and it's a human condition, and we're all human, and we're all going through it together.
So with this, in summary, I mean, we're encouraging not just to be open to talking about the quote unquote difficult situations, the personal things, but just remember that, as far as the 5 reasons you should open up, it's not your fault. Wishing it away isn't an effective treatment option. You're not the only one dealing with this issue, and addressing it gives you control, and talking about it also helps yourself and helps others. You can learn more about this on our post in the Mango Health blog. It's at mangohealth.com, and look at the blog because we talk about these issues, go a little more in depth with this. But thank you everybody for tuning in today to hear our program, A Couple Takes on MS. Thanks to MS&Me Radio Network for making us part of the lineup for all the incredible hosts. We're honored to be there.
And thank you for listening, and don't forget to reach out to us on Twitter at DanJenDig. On Facebook, we're at Dan and Jennifer Digman.
And online, our website, danandjenniferdigman.com. Until next time, this is Dan Digman.
And Jennifer Digman.
And thanks again to Blue Draft Kid for composing the theme music for our show. Until next time, which will be our 37th episode, take care.